Over the last 120 years, prescription drugs have brought many positive effects to its users. Prescription drugs are used to treat illnesses to patients suffering from a wide array of sicknesses. Prescription drugs could be considered one of the hugest advancements in the medical field throughout the years, but once put in the wrong hands, the effects can prove to be fatal.
Prescription drug abuse is to use any medication that it's not intended for. Mostly narcotics, opium derivatives, some tranquilizers, some sedatives. It's a good question. I really don't know why any teen, I don't know why anybody would use drugs for recreational use. Oh, definitely. It's definitely increased. Probably 30, 40-fold over what it was 20, 30 years ago.
I think it's an issue in most high schools in America. I think in Connecticut it's an issue, yet it's an issue that we do know that does exist. The way it works with prescription drugs is they are according to what's called a schedule in the penal law. Some are considered misdemeanors. The sale of them is considered a felony, but it depends on the actual drug itself, whether it be OxyContin, Xanax. So it depends on the particular prescription drug that we're speaking about. And that can vary based upon what kind of drug we're talking about. Whether it's an amphetamine, if it was an amphetamine, they would be speaking very quickly. We also look for the pupils on somebody, if the pupils are dilated. Somebody who may be taking a depressant such as Xanax, speech may be slurred, they may walk unsteady on their feet. So some of the administrators in the district have been specifically trained by the Suffolk County Police Department as far as what signs to look for. There's something in the Code of Conduct that states how the student is supposed to specifically handle their medication, and that in most cases that's kept in the nurse's office, and when the student needs it, it's supposed to go to the nurse. So all of those circumstances are taken into account. I think that's my biggest fear, both as what I do in security and as a parent myself. And it's the same for students and adults, is that everybody reacts differently to prescription drugs. Some kid can take one and be okay. Some kid can take 3 and be okay, and another kid can take one and overdose. So that's the danger of the prescription drug.
Drug use, yes. I think it is abused a lot because it's available. Parents don't think that when they're leaving OxyContin or hydrocodone or anything else, any other kind of drugs, they don't feel that their kids will take it. And it's something easy to sneak out of the house and get a quick high. People that do an opiate become addicted. They love that high, that feeling. So once they get that opiate, just as heroin, they're addicted immediately. So I have dealt several times with people that have overdosed on drugs and on prescription, and sometimes they don't even realize that they do it. And believe it or not, it's not just teenagers too. Sometimes the elderly will overdose on a prescription medication and not realize that they've taken it once or twice. People don't understand the consequences of them. Like when they tell you take 1 pill every 4 to 6 hours, there's a reason for that. We've had a lot of kids that are doing the Xanax bars. They do the rainbow parties, which is the part where they come in and they have the prescription that they take out of their home. They walk into a home and they drop it in a bowl, and they all just take from the bowl and just pop pills left and right. If they overdose on an opiate, such as heroin, there is a drug that counteracts it, Narcan, which we would give them Narcan, and it brings them back. Our main concern is trying to keep that patient awake, breathing, and that is our main concern at that point. And then just take them to the hospital as quickly as possible. You can go into any home, anywhere. They go into the medicine cabinet or the drawers, and there's the medication.
That nationally, prescription drugs is a problem in all high schools. The access that students have to their own parents' drug cabinets and home medicine cabinets, and also to friends who also may have certain prescriptions, is supposedly issue nationwide. I do know that our 11th grade health program focuses quite a bit on prescription drugs, but that is clearly too late in students' schooling here at the high school. You know, discussion about prescription drugs have to be integrated into the curriculum, into our daily academic program here at the high school on a daily basis. Awareness is everything. One of the key factors that I believe will help to address this issue, if students feel comfortable enough stepping forward and letting us know when a student has a problem. The focus can't be on wanting to throw a student out who's got a prescription drug problem. The focus really needs to be on providing that student with a level of service to help them. They can get access to the prescription drugs likely at home, could be through their siblings, could be through their parents, and unknowing to those people who have the scripts in their medicine cabinet, unless they're counting those pills, it's very difficult to track what may or may not be taken. And then certainly, you know, prescription drugs is an issue with peers in schools across the country, because they become very lucrative in terms of being able to be sold off. And that being said, you know, students are making quite a bit of money, we're being told, selling their own prescription drugs. I understand that some of the drugs out there that are very popular for sale are Vicks, Percocet, Ritalin, as well as Xanax happen to be very popular amongst purchasing for teens. In fact, the nurse should be contacted via the parent through a doctor's note, even if the student's on a prescription drug that they're taking at home, just to let us know what that medicine may be. So this way, if we see any you know, interesting effects or an impact that's, you know, causing that student to have difficulty in school, we're aware of it. You know, it's a protection for the student, but most importantly, you know, the nurse has to manage in terms of providing oversight with all the prescription drugs that are being administered here in the school. We have very good resources here between our guidance counselors, our YFS workers, that's the Youth and Family Services group that's next door to my office here. Those individuals up in Youth and Family Services play a key role in terms of helping coordinate and provide services to students with suspected prescription drug or substance abuse issues. We often provide referrals to students and to parents, pointing them in the right direction to get the appropriate level of service to meet their health needs.
I feel prescription drug abuse is an increasing problem in our community, yes. I do think pain meds are used inappropriately. A lot of people go to their general practitioner to get prescriptions for pain meds, and I do not think that a lot of these doctors are following up appropriately. A lot of people, I feel, should see a pain management doctor for pain. I do speak with a lot of nurses that work in the emergency room, and they have told me stories about a lot of teenagers that do come in. The most commonly abused prescription drugs are oxycodone, Percocet, morphine. I do not feel that the problem with prescription drugs are given enough attention in our area or any area. I do believe it is a big problem. Some precautions that are taken in administering prescription drugs to patients are you need to get a good history from the patient. They also need good follow-up care. The procedure for someone that's overdosing on prescription drugs, if they come to the hospital, we do get in touch with poison control. Because different drugs have different procedures and treatments. I would say that every age is at risk, and I have seen every age. Teenagers, people in their 20s, 30s, 40s. I see a lot of people even in their 50s and 60s that are addicted to painkillers.
I pledge to stand against teen prescription drug abuse.
I vow never to go against my doctor's orders.
I promise not to abuse any drugs given to me.
I hereby swear to take special consideration in all medicines I am given.
I'm not going to take any medication not prescribed to me.
I would do anything in my power to help anyone that I know get over an addiction to medication from which they cannot get rid of.
I pledge to take a stand against prescription drug abuse.
I promise not to take any medications not prescribed.
I promise to be responsible with the drugs prescribed to me.
I promise to give my all to go against prescription drug abuse.
I pledge to spread